Everybody on?
Thank you for recording. Welcome to Conlon. You guys are just now joining us. Please mute yourselves out. We're going to get the meeting started in about 2 minutes. Mute yourselves out, folks. Roger, muting you. I'm not muting Lee. I don't want to get in trouble. Not going to do it. Not doing it. Not muting Lee Rush.
How was everybody today? If you be so kind and put your name, organization, and contact information in the chat, that'd be great.
Thank you. Thank you. One second, guys. I'll be right back.
Hi, just checking. Is my voice working okay, Fania?
Your voice sounds like it always does, Tim Devitt. Thanks for joining us this afternoon.
I appreciate that. I'm going to
Yeah.
support later, and I want to make sure that this audio is working.
Appreciate
so much.
it. You guys, I'm going to leave that agenda up there for just a little while longer.
Today is the first day of spring, y'all. First full day. Are you feeling good? We'll get started in a couple more minutes. Dr. Jenny, if you need it, I made you co-host.
Great, thank you.
"41 participants. Wow. If you're new to the crowd, thank you and welcome. Please put your information in the chat box, name, organization, email address. I have my nephew today and he just keeps turning the light out. So
Also, too, if you see anybody in the chat you want to connect with, reach out, touch them, say something to them, say hello. Remember that any private chats that are said in the chat room privately, we can read. So, we know what's happening. All right.
We don't want to stifle that community, but just no verbal eye rolling or written eye rolling.
That's why I said, if you got a misgiving about Nichols, that girl sweet as pie, but she can go somewhere else. I'm not married to her in that regard. I'm more married to the culture and what I see PCS.
let's mute ourselves out, please. We're getting ready to get the meeting started in about a minute. We don't want to be privy to any other conversations that don't have anything to do with the meeting. You guys are going to get started shortly. We are recording. The chat box is still going. The room is being populated. Fania, Lee, whenever you guys are ready, I'm going to continue to populate the room.
How are you guys doing today? Welcome to our task force meeting in March. It is the first day of spring and we're about to get started. So who is new to our meeting? Please unmute yourself, raise your hand, tell us about yourself, the organization you're with, the role of the organization, as well as what brings you to our meeting today.
I guess I'll get started first. I'm new to this meeting and thank you everyone for having us. My name is Shannon Clark and I'm the Director of Advocacy for U.S. World Meds, and I have my colleague Jake Nichols on this call, and thank you for the opportunity to talk a little bit about our product Lucemira, and I won't say much about it. I'll let him kind of he's on the agenda, and I'll let him kind of talk about what Lucemira is all about. So thank you for having us.
All right, thank you for coming, Shannon. Appreciate it. All right, Chelsea.
Hey girl, hey.
How are you?
How you doing?
I'm good. How are you?
Long time no talk.
Yes.
Hey, everybody. I'm Chelsea Laliberte Barnes, social worker, and I'm co-chair of the Illinois Harm Reduction and Recovery Coalition. I just wanted to say hello and let y'all know that we're having an advocacy day down in Springfield on April 17th to support overdose prevention sites legislation. If it's okay with you, Fania, I'm going to put information about getting involved in the chat. The coalition's willing to pay for train tickets and gas and food and anything people need to get down there, because let's face it, we need to keep people alive, right? And we need to tell our legislators how to do that. So if anybody has questions, don't hesitate to reach out to me. And thanks for hosting this amazing meeting. I love you all.
Thank you, Chelsea. Can you tell us more a bit about Illinois Coalition for Harm Reduction? Just a little bit. Just tell us a little bit more for those who are new to the meeting.
Sure. So we're a statewide coalition. Our fiscal agent is Chicago Recovery Alliance. We are very grateful for that. We have about 500 members from all corners of the state that rely on us to support them where it matters with policy and making sure that we can advance not only harm reduction, but recovery support, peer support services, outreach services in your communities. So we're talking about making sure that our government invests in harm reduction and recovery support services in a real way that's long lasting and not just for Band-Aids. And also with policy change, civil rights and human rights, making sure that, for example, police aren't trailing your outreach units and the work that you do, making sure that, there's space there and that they understand why. So you can join our meetings. We meet once a month on the third Tuesday of every month at 2 p.m. IllinoisHarmReduction.com. .org. I'll put it all in the chat because I feel like I'm taking a lot of time. So thanks for that though.
Thank you. I appreciate all the work you do. All right. All right. Anybody else new to the meeting?
Yes, my name is Kaaron Westside, and I am with PWP Health. And this is my first time here, and I am on the agenda, so I'll save my little bit for when it's time for me to come up. I am mostly going to be listening because it's my first time today. So I want to see what you guys are doing and what you're talking about. Thank you.
Welcome to the meeting. Appreciate it. All right. I can't wait for your presentation today.
Okay.
All right, Kathleen.
Hi, everyone. My name is Kathleen Conlon Wasik, and I'm with the Buehler Center for Health Policy and Economics. And I'm here to present today, so I will tell you all about us then. It's lovely to be here, and this is a very small community because I've seen so many people I know already. So this is lovely. So I'll talk to you all soon.
All right. Thank you, Kathleen. Anybody else new to the meeting?
Let me just introduce myself, even though I mentioned I used to come to this meeting years ago, but I'll introduce like I'm a new member. Richard Hart, I'm the director of the Salvation Army Residential Reentry Center, and that's also called the Federal Work Release in the West Humboldt Park area.
All right. Welcome, Richard. Glad to see you here. All right. I do not see anybody else's hand raised. Welcome once again to our a monthly meeting, March meeting, and I'm so glad you all are here. We do not have any legislative update, I don't think that I see. So we are going to move on to a person that I met in person a week ago, and she is just a delight, is Dr. Jenny. She is our new medical director of behavioral health for Chicago Department of Public Health. And she's going to present herself and tell us about what she envisions for Chicago Department of Public Health, especially the Office of Substance Use. And she's going to tell us about what's happening. All right, Dr. Jenny.
Thank you, Fania. I had the delight and the pleasure of meeting the crew, Fania, Lee, Lou, Tim at Westside in person last week. And I'm so excited for the work that everyone convened here has been up to. And so I came into this position as medical director of behavioral health at the Chicago Department of Public Health in December of 23. So, over 3 months in this position. Some of you may know my predecessor, Dr. Wilnice Jasmine. So I am really delighted to talk. I think, you know, if it's okay, I have a slide deck that I will share and sort of give an overview of the work that our office has been doing. I certainly cannot take credit for most of this work, given how briefly I've been in my position, but I think that it's all headed in an amazing direction. And, you know, we will need all of the help and support and input that we can get, especially from the folks assembled here. So without further ado, let me first give an overview of my understanding of where we're at in terms of the work that our office does. And then hopefully there'll be time for discussion, brainstorming, and conversation. All right. So that's who we are. We are the Office of Substance Use and Recovery Services at the Chicago Department of Public Health. My name is Jenny Hua. So our program invests in substance use along the continuum of care, prioritizing systems coordination, data analysis, and stigma reduction. So these are systems, you know, parts of services that we both fund and also keep in-house within our office. I'll start with a bit of a data overview. Some of this probably familiar numbers and trends to you all. I've actually lifted this from our to be soon released opioid brief, which encompasses new data from 22 to 23, provisional data from 23. But what we are seeing starting in 2018 is this dramatic rise in the number of fatal overdoses due to opioids in Chicago. The red line outlines how many of those are due to fentanyl, and you can see that, you know, it's becoming it's always been high, but an increasing proportion of the number of deaths are due to fentanyl, right? And then we see this peak in 2021. And since then, since 22 and 23, we're hoping that the number of fatalities have plateaued / started to decline ever so slightly. So this is an encouraging early sign that, you know, we're maybe seeing this horrible trend turn around ever so slightly. But, you know, we still have to keep in mind that this is a historic high, right? So in 22, there were more opioid-related overdose deaths in Chicago than homicides and traffic crashes combined. And this has been sort of an unfortunate sum that we've reported repeatedly in our conversations with the community for the past few years. Again, you know, highlighting that this is a fairly recent trend. And so this is sort of an all hands on deck crisis that we need to combat because it doesn't have to be this way. Fentanyl involvement continues to be on the rise and is now the vast majority of opioid overdose fatalities accounted for by fentanyl involvement. Overdose affects every community in Chicago. So 100% of Chicago's community areas have had an opioid-related overdose EMS response, and 98% were home to at least one resident with a fatal opioid-related overdose, and with a concentration in the Westside neighborhoods, which this group is so active in. So Austin, West Garfield Park, Humboldt Park are our top community areas that sees the most number of deaths due to opioid-related overdose. And in terms of the breakdown of who is affected, the vast majority are men. And in terms of race and ethnic groups, 61% were non-Hispanic Black individuals. And so we emphasize in every aspect of the work we do at the health department how to combat the structural racism and racial life expectancy gap, of which opioid overdose is one of the top drivers. So let me transition to talk about some of the major initiatives housed both within our department and done in collaboration with our community partners. So the first one, this is sort of in no particular order. This is just, the way that the slides came together. So the first one I'll highlight is Medication Assisted Recovery Now, MARNOW, which was started in May of 22 in conjunction with the Illinois Department of Human Services. We've stood up this hotline that engages with people who can call this number 24/7 to be connected to substance use treatment telephonically. Many people who use this service, in fact, I think the vast majority choose to be induced on buprenorphine at home. So there doesn't even need to be an in-person appointment. It's a completely telemedical encounter. This has connected over 500 people to substance use treatment since May of 2022 when the program was launched. I think this data is a little bit dated, so the number is more like 800 now, I believe. And 99% of people calling for home induction on buprenorphine actually successfully completed the induction in December of last year. We also expanded to include medications for alcohol use disorder, naltrexone, disulfiram. So that these are all sort of very exciting directions that we're hoping this program will head into. I also want to highlight the opioid response team, ORT, which follows up with individuals who overdose non-fatally on the west side of Chicago about 1 to 3 days after the event. So the team is comprised of peer recovery coaches, community health workers, and as well as emergency medical team. So this is a collaboration with the Chicago Fire Department. And it's the fire department's data that guides us to be able to respond within that 1 to 3 day window immediately after an overdose event. So, you can see that from its inception, over 600 outreach attempts, 52 individuals located. Also, Narcan kits and fentanyl kits are distributed. So this image is lifted off of the CARE dashboard. So CARE ORT is part of the CARE program, and all of their data and activities are reported in a publicly available dashboard on the city's website. I'll just highlight as well the Narcotics Arrest Diversion Program. So this is a program done, we fund thresholds to do this in conjunction with the Chicago Police Department. So when an officer arrests an individual for drug possession, eligibility into this program means that they can be diverted into treatment, right? And or released without a charge. So this is trying to both decriminalize, but also to connect people with care once they are released. So there have been over 900 individuals. Again, these are somewhat dated data. So imagine there's over 1,000 now. And 80% of those who were diverted from their arrest received treatment. And individuals who are diverted are 44% less likely to be rearrested in the future compared to those who were released without a charge. And this is another development that was a pilot program that we launched in November of last year. So these are the public health vending machines, of which there are 5. You probably heard about them in the news. So we do have new data that's linked in the slide. There's a vending machine pilot program brief where these numbers are lifted from. So since from November 2nd, 23 to January 9th, 24, we've distributed 662 unique PIN codes. So each PIN code corresponds to an individual, and Narcan is actually not one of the most popular items we've distributed, although I think it's the 3rd most popular. There's been 328 kits, Narcan kits distributed. By far the most popular are socks and underwear kits and general hygiene kits. So 16% who register for a PIN code completed questions. Well, so over 80% completed a questionnaire that is associated with the PIN code, but 16% of those who completed the questionnaire reported experiencing an overdose in their lifetime. I believe an even higher percentage have witnessed an overdose, and 49% witnessed an overdose, and I think 47% report being unstably housed. So we're reaching precisely the target population that we thought this program should prioritize. So we're really heartened by the results. Finally, well, maybe this is not my final slide, but we also provide public access to Narcan through all 81 branches of the Chicago Public Library. This is a program that started in January of 22. And between January and 23 to December 23, this program has distributed over 29,000 Narcan kits. So just over a year, this is how many Narcan kits have been distributed. And the vast majority of those, I would say, comes from the libraries, but we also engage with mental health clinics, automatic offices, bars and clubs, as well as faith-based institutions. And there's again, this link, I will circulate the slides after this, but the link in the slide is active. You can click on the Find Narcan link, and there's a bit.ly associated with it that will pull up the map that shows all of these locations where Narcan can be obtained free of charge. And I think this might be my last slide of this section. So the last but not least, we have convened and will soon convene again with this group and everyone else who might want to be involved in this discussion to go over hyperlocal heat mapping data. So we did this monthly, I think, until August of last year, and when we had a pause in which we were re-engaging with the Chicago Fire Department for monthly data releases, and that's been catalyzed over the past couple of months. So we do have new data updates that our GIS analyst, Livia, who I think you all know well, is working hard to prepare for the meeting that is going to be at the end of this month. So, we partner with you all to provide outreach information, right? Which areas in your neighborhood, which block ought to be prioritized based on most recent EMS response data. So we're really excited to get this off the ground again. So looking forward, I know there are always, opportunities that we try to bring to your attention. Funding opportunities and opportunities for engagement and collaboration. So I just kind of listed out some of the opportunities that have recently been on the docket and that we're looking forward to. So starting with the harm reduction services opportunity, this will be funding drug checking and harm reduction outreach services. So we have selected 5 organizations that will receive $250,000 per year over the next 5 years. The contracts are in process and some of these organizations are probably in this meeting right now. So we're really excited to partner with you all, and we'll have information forthcoming on getting set up. And this is a very innovative, novel program that I think Chicago is really taking leadership nationally in trying out. And so I think all eyes are on us in terms of how we do and our initial outcomes. So I'm really excited about this. Our linkage to care and treatment RFP recently went out and it closed on January 12th. The awards are in process. So this will fund up to 10 organizations for up to 3 years to provide outpatient substance use treatment and linkages to high priority populations. We also had a recovery services RFP. RFP stands for request for proposal. Apologies for the acronym. This was to fund innovative recovery support services for people with substance use and their families and communities. So this is a less clinical type of recovery support services that we were hoping to fund in the community, whether it's alternative healing programs, community support groups, faith-based healing programs. So this, I think, recently closed, but it will likely be reposted because I don't think we garnered as many applicants as we had hoped for. So, we'll likely repost this towards the end of this year. So it's also hoping to fund up to 10 organizations, 200,000 a year for 3 years. We have a recovery housing opportunity coming down the pipe that I have already been in several conversations with this group around how do we pitch it, what are we prioritizing in terms of low barrier access to recovery housing. I've been in conversation with I think the COSAP group. I don't remember what that acronym stands for, but it is a Cook County Health-led recovery home capacity building program, of which I think many of you are probably familiar with. We at CDPH have been engaging with that group to make sure that our goals are aligned and that we are supporting programs that are already sort of moving towards a more low barrier harm reduction model to do more of that good work. So I'm hoping that we will have a mid 2024 release date for this funding opportunity. But this group will be the first to know. We, in conversation with the Westside Heroin Opioid Task Force, I think, and we strongly believe that we need to make funding opportunities available on an equitable basis, and in particular for smaller organizations that may be representing historically disadvantaged groups. I know that the city's funding opportunities are oftentimes not the most accessible, and the application process can be quite onerous to tackle for a smaller organization that does not have a grants department, right? So I am hoping that we can create a cohort of organizations, maybe around the goal of providing street-based or brick and mortar peer-based outreach to prioritize communities in Chicago, and maybe to have this set up as an incubator of sorts, right? To have technical assistance on the front end so that by the time the RFP is open, then groups will have at least the baseline knowledge to navigate the city system for submitting grants, so grant applications. So this is sort of a very fast and high level overview of what our office has been up to and what we're hoping to engage with you all around it. There's much more that I can talk about, but I think I'll just stop there. And the bit.ly/find Narcan, the Overcome Opioids, these are all web pages that we have developed to centralize some of the resources that I've alluded to. So I think I'll stop there and I can stop sharing my screen and be available for any questions.
Thank you for that presentation. Anybody have any questions for Dr. Jenny? Just raise your hand and we'll call on you.
Free fall. We don't have anything in the chat right now, so you guys can raise your hand at any time.
Yes. Chelsea.
Okay, Jenny, you are amazing. You're doing a lot, but I have a very important question for you. And I understand if you can't answer this publicly, but we would love to know where the department stands on overdose prevention sites and when you think, what you think sort of a pathway is, considering the fact that we have a lot of legal sort of steps to take. And considering the fact that Mayor Johnson has been relatively supportive of moving forward with those, can you just talk a little bit about if you think that's a reality?
Yeah, I mean, thank you, Chelsea, for that question. I personally, speaking just for Jenny and not for the Chicago Department of Public Health, thinks that that is a really important priority. And thank you for your advocacy around this issue. What I've heard since coming into this position is that there's certainly no no opposition to it within the department, right? So I think everybody in our office, in our bureau, would be supportive. That being said, these are not sort of our decisions to make. So I think it's a matter of how do we sort of internally and externally organize to elevate this for the mayor and for the state, right? I do imagine that the pathway that we have to take might be dissimilar to the pathway taken in New York City, in which there was no state legislation that that permitted this, but it was sort of a understanding that was struck within the local jurisdiction that this would not be litigated if this became a reality. So I'm not sure if that is the path that we have to take to make this a reality in Chicago, or if we really do have to go through the state-based path. But I believe, there are probably people who are smarter policy people than me who can determine that. But I think the prior commissioner and the prior mayoral administration had been briefed about this, and we just have this, there's just, we need to line this up on the docket, and there are other things. And so we're most likely getting there. And if you would like to advocate for that, through your networks and with the mayor's office and whatnot, it would elevate accordingly, and we could bring this on the docket and make sure the briefing happens. But yeah, no, I think we would welcome that kind of advocacy from you all.
You are a breath of fresh air. Oh my gosh. And follow-up question is, okay, yes, we will reach out to you, but follow-up question is, what about drug checking? We're doing great, right, with the tests, but I think many of us here feel strongly that we need to elevate our spectrometry services and make sure that people are trained up to actually execute that. Is that also a part of the plan, or should we make it?
I'm so glad you asked. So I'll share this slide deck, but one of the in the RFP slide that had a lot of words on it, the drug checking request for proposal recently closed, and we do have 5 organizations that are funded through a combination of opioid settlement and CDC dollars to do community-facing drug checking, FTIR. And in coordination with that effort, we are also funding Rush University to build a regional toxicology lab with a mass spectrometer that will be able to validate the results submitted from the community. So this way we are building capacity within the community to perform these tests, through validated ways. So that project are sort of top priority right now for the office to get the administrative pieces in place so we can launch, right? So I think yeah, so thank you for asking that question. We're doing it, and we're very excited about it.
Good questions.
Thank you, Dr. Jenny, and thank you for all of your questions. Really quick, speaking of Rush University, Dr. Jenny, and welcome. Thanks for being here. Dr. Tanya Sorrell said Boston is also moving forward with an OPS without state legislation. So this seems to be something that's happening a lot. It's on the horizon. Is this something that we can be expecting?
Again, like I think these require sort of high level conversations with agency leads that I'm really happy to sort of elevate on your behalves. But I confess that this is sort of beyond my scope in terms of being able to say that this is what we need to do right now, right? So this is something that the mayor's office would kind of have to determine to be something that is on their priority list. What we can do is to elevate community voices, right? So when you have, the ability to reach out to us and sort of ask for meetings and, request that that this is something that the community perceives to be a priority, then we can sort of elevate accordingly and go from there.
Thank you, Dr. Jenny. Anybody else have questions? Thank you, Chelsea, for those questions. Really good. When it will be the data meeting for the Westside, and how's the Westside looking for overdoses?
So the data meeting, I believe, is the last Friday of this month. If you have not received an invite for that, please email me. Just email me. I'll put my email in the chat if you would like to be on that invite. But I think the invite had already gone out pretty broadly. So check your calendars. It should be the last Friday of this month.
At 10 a.m.
Yes. Yes. Becky has a question.
I wanted to flag two things that I put in the chat. I think as a coalition, the Illinois Harm Reduction and Recovery Coalition would love to, really appreciate your openness to talking about this, and it might be helpful to have a separate conversation too, just to like figure out a path forward to better understand, what you are able to do, where the limitations are, so that we aren't putting you in an awkward spot at all, but recognizing that we do really appreciate your interest in making this happen. And I suggested in the chat too, maybe like including Matt Richards as part of that, since he has a good track record of figuring out how to maneuver these things through various administrations. And then I did just want to flag too that Chicago does have the precedent of having allowed for decades SSPs to operate without state legislation in place. So if that is something that's potentially on the table, it's not as if we would be creating that out of whole cloth. And, John and his colleagues from Chicago Recovery Alliance, I think, would be really insightful in giving us information about how that happened. I randomly happened to work for the state legislature 25 years ago when something was happening. So
thank you so much for that, Becky. Speaking of John from Chicago Recovery Alliance, he has a comment in the chat that says this has come up recently, and those drug checking services are to provide health information to folks and not a diagnosis. Thanks for that, John. We appreciate that contribution. And we are at 1:37, so I think we want to move on to our next presentation. If you have any more questions for Dr. Jenny, you can follow up here in the chat and we'll get back to you in our follow-up email.
All right. Thank you, Dr. Jenny, for that presentation. Now we're going to move on to Kathleen. She is a data person with Northwestern, and I am so looking forward to this presentation because she's going to tell us what Northwestern can do for us, especially as we're writing grants. We need information around people regarding overdose, as well as some violence prevention pieces. And so Northwestern has done a deep dive into those who have died. The dead have stories to tell. And so, Kathleen, if you would like to share with us your presentation. Oh, you're on mute.
Look like they're connecting to audio on that end. You let us know if you need any help, Kathleen. Ms. Rao.
Oh, how's that? Hello, everyone.
Here you go, Kathleen.
Okay.
We've got you.
Okay, great. It's wonderful to be here. And thank you so much, Fania, for this opportunity. Again, we're here to support, and I have more data for you today. And so I'm with the Buehler Center for Health Policy and Economics, Feinberg School of Medicine, Northwestern. Our team, I'm having trouble here.
Here for your tech needs, Kathleen. Just let me know if there's anything I can do to help you.
Yeah,
Are you looking to advance your presentation?
Yes, I am.
You may be able to just click it. You have control of it on your screen. Just click your login and see if it advances.
There we go. We're doing good. So basically, I'm here to talk about two systems, and they belong to the Centers for Disease Control. Basically, our group within Buehler, we're an odd duck because we're actually funded by the Center for Disease Control, and we're also a bona fide agent of the Illinois Department of Public Health. So we're in this very interesting space. We're a public health surveillance system. Again, looking at the who, what, where, and how. of preventable violent deaths, so we can work together to figure out how, or why. So public surveillance system just looks at data as it is, the best information that we can get at a point in time from our coroners and from our medical examiners' offices. We also get data from toxicology reports, autopsies, police, hospital, paramedics, and news reports. And we get this information from across the state. So we're not Chicago specific, but we do have, and we can gather information at the state level, at the regional health department level, groupings of 9 and 10 health departments that are grouped by region. We can group on the county level, and we can go down to in the Cook County level onto the west side and into, as Fania and I have looked at, particular neighborhoods. And we can go below that, but the data starts becoming fuzzy when we get into very low levels, because the data that we look at has to speak to us and give us information. So as Fania said, the dead can speak if we're willing to listen. So our data looks at, goes down into where we can recognize patterns, where we can see moments of intervention, and then we can look at that together and figure out how we want to move forward. And so that can help you with getting your grants, with having data that is considered legal documentation to back up your work. We can help you with that. So I'm paging down. Let's hope this works. It does. So I'm going to begin with the Illinois Violent Death Reporting System. It's one of the two systems. Within the two systems, we have about 2,400 fields, IVDRS by itself. The Illinois Violent Death Reporting System has about 1,800. That system deals with homicides, suicides, looks at legal interventions. It really starts digging down into the demographics and the scene data for these individual cases, individual deaths. So with this information, we can tell the story. So for example, the place where a person was born, where they reside, their occupation, education level, all of these pieces of information can help us when we're doing outreach work. So for example, Fania and I were talking because we were able to look at the education level of people who, some of the decedents from the East Garfield Park area, and we realized that there was an educational attainment that, when we put out documentation, that we would want to make sure that it will reach that group. And there were also some protective factors that we noticed, so we can identify who is most at risk. So we can spend our time working with people who we believe, are most at risk, are whom we have, the best chance of helping. The SUDOR system is our statewide unintentional drug overdose death reporting system. Again, we're gathering data from the same spaces. We go into very granular information on these people's lives, the kinds of drugs that were in the body at the time of death, and things like that. Here are some of the variables. These are fields that we are tracking information on, that people have asked questions about, and that we can easily run reports on. But then again, as we found out at the last meeting that I went to, you might just have a question off the top of your head that you may say, hey, can you give me information on this and that? And we can go back and take a look at it. And many times we can get that information or get very close to it. So it can help you getting closer to the people that need your support. Suicide-related data. This gets into, a level of if there was a problem, if it was a young person, or there was a problem at school, or there was a crisis at school, where there was, trauma, what kind of trauma in the family, bullying, all sorts of things that we can find out about the life of someone who's passed in our community. This is a report that Fania and I looked at. Basically, Fania was thinking of going out into block by block, doing a block by block type program in her area, zip coded by zip code. And she wanted to know, can we give people information about who's at risk, and so that they can, either have a thought in their own minds, hey, I'm getting myself in a situation where I'm going to be at risk, or I know my kids are at risk, my friends are at risk, and here's what it looks like, and from past experience of people who succumb. And so we can put that kind of information together. This is not exactly what you're looking for, but it'll give you an idea of, here it's got Cook County and DuPage County, but we can actually have that down to zip codes, and or even by neighborhood. And then with, the information on the side and who to call and what to do. So that is the kind of work that we can provide for you as you put together your outreach. And so our vision is to work with you to identify at-risk populations, gain those insights by working with you. You're the boots on the ground. You know your community. And by working together, we can connect the dots so that we can be most effective with the resources that we have. So at this point, what I'm going to do is I'm going to jump over to a report that Fania requested, and we're going to look at it together. We'll do it very quickly. So I'm going to stop sharing for a second and hopefully get rid of what I have on the screen and start sharing again. And can you see this report?
Not yet. We'll let you know when, Kathleen. You might have to stop the sharing again.
Okay.
Good to you. And then give it another try.
Okay, here we go.
There you go.
Oh, we got it? Okay, great.
We're seeing like an Excel spreadsheet, green.
Yes, we are. So
Excellent.
let me get it into order for you so that you can understand what you're seeing. So basically what we have here is we have some data over time for people who have died of overdose deaths in your community by zip code. So this is the 60644 zip code. And we have the other zip codes here that Fania requested. So imagine all of this data going across all of these sweeps. We can also group it together in one, but we'll get to that in a minute. So as Fania and I went down this data, I want to help you understand it so you can look at it. So right here we have male, female over the years. You can take a look. And then where you see it feels not filled in, this means that there was no data in this age group for that period of time. Okay? Or actually, it could be below 4 or 0 for that period of time. So we're going to go down and look at this very quickly. And so what I want you to do as a little exercise, and Fania and I did this together, is take a look at the information, see how it changes over time, right? And go through each one and notice these little trends, right? And it starts to tell you a story.
Now, Kathleen, would this be something that we can share as part of a follow-up from today's
Absolutely.
meeting?
I'm going to run through this really quickly because I have something else. I want you to look at this, though. I want you to see across the board, because this is helping you understand how we can start to put together stories. So you can do this. Just as the experts can, you can too. And now we're going down to take a look at the type of drug that was in the bodies. This is for the 60644, but we can look at others as well, and the numbers can get very jarring in some of the other communities. Alcohol was involved.
What was interesting, a part of this report was the bystanders who were in the area who could have had Narcan on them. And the data that was collected, the police officers sort of know how many people were around when a person overdosed.
Right. So that is for one community. We can look at them across every single one of them, pull all of the stories together, and then come up with a picture of, what is going on, who is affected over time, so we can identify in the future. So one of the questions that was asked, and I know it's very uncomfortable when the presenter's quiet, but and I understand that. But it's also a moment for you to think a little bit about this data, because sometimes it can look jarring, but you can actually start telling stories with this. So I want to jump over here. So these are the zip codes that we were working with, and some of the zip codes overlap, but the data doesn't. So that's an important thing for you to know. But at the last meeting, and this is a very raw piece of information. At the last meeting I attended for the Westside Coalition, someone asked a really amazing question. How many decedents in these categories actually died, resided in our community and died in our community? How many did not? And so I asked that question of our epidemiologist, and I would say about 40 minutes ago, I got the response. So this is very new data. And to be quite honest with you, it was a little bit jarring for me for some of the communities. But when we go down here, we can look this is the suicides. Over here, we're looking for homicide deaths and for the overdose deaths. So take a look at this by community. I'm just going to take it down. This is for the ones that resided and died on the west side of Chicago from the period 2015 to 21. Okay. So in each zip code, we have it broken down here. So you get an idea of what that looks like for resided. And then over here, sorry, those that died in the community, but they didn't reside here. So that was one question that was asked, and that's the kind of thing that we can do. If it's informative for you, if it helps you with your outreach, if it helps you, one of the things Fania was talking about, where do these people come from? How do we get help to their communities too, which is, very compassionate way of thinking. But oftentimes, this particular West Side gets, we say, look at the number of people are dying there, but they don't live there. Look how many. I was in shock, to be honest with you, when I saw these numbers. But yeah, this data is available for you. I know I'm going through it very quickly and you will need time to think about it. I have sent my my PowerPoint to you. This data is brand new. I will send this new data to you so Fania has it and you can take a look at it. And then if you have questions, we're here to try to help you answer them so that you can do the good work that you do. Are there any
Kathleen, thank you
questions?
so much. You do have a question in the chat. Richard wants to know, how is this data collected from the Cook County Coroner's Office?
How is it collected? Well, the Cook County Coroner's Office, so what they do is they have a vital statistics records that they keep, and the data that the information that we need it meets a certain standard for data type. Suicide, homicide, and overdoses. And so it meets that type, that criteria. And so anything that meets that criteria, we get the individual case data for. So below this data, there's just reams and reams of individual cases. And each case, there's up to 2,400 fields that can be filled in. And so that's where we get the data. We also, the data comes from the medical examiner's office. For the most part, in Chicago, we have a tremendous medical examiner's office. They also collect data from hospitals, from paramedics. The data across the state can be a little bit uneven. It'd be great if we had a policy to create kind of harmony within the data collection, because this information, when given to community action groups like yourselves, to to health departments and to hospitals, this is protective. So So yeah, does that answer your question? I think it does.
You can come on if you didn't get your question answered, but Sue Pickett mentioned this data also helps address concerns people have about OPS, that it will bring more people who use drugs into a neighborhood and doesn't serve the neighborhood. Thanks for that, Sue.
Yes, so this particular graphic is not, you know, it doesn't communicate as well as we'd like it to because it's brand new. However, it does get you thinking about information, how it can help you. So we are here to support your work. We don't do the immediate work. Our data is always a little bit behind because of the amount of work that's involved in the accuracy that's involved. You know, the CDC reviews every single thing we do, so that when the data comes out, these are legal documents that you can use in your work. And yeah, so we're here to support the community, all of the groups. And so my contact information is on the slide. We hope to hear from you. We want to hear your questions. And someone said the data is free. Actually, the data is paid for through your tax dollars. So next time you complain about that, these are your tax dollars that work for you.
So I'm so glad Sue mentioned that, because it looks like in Austin, just the for 228 people died of overdose, but only, and then 71 folks or 77 folks were outside of our community who died of overdose in that time period. So it helps us in our understandings about what we need to do and how do we create, right now, I know all of us are in funding cycles, grant cycles. We have to write grants that sort of have to forecast, right? Forecast programs we want to do to lessen overdoses and to eliminate, prevent fatal overdoses. And so this data sort of helps us to figure out how to create programs that can help people who use drugs, right? Manage their drug use, understand drug use, and also to where we put an overdose prevention site, where we put a site for harm reduction. And so I think that's a really important contribution you make, Sue, there. All right, anything else? Thank you, Kathleen. And once again, this data, what she does, it is a taxpayer funded, but we can get this data. We don't have to pay anything out of pockets in our organization to get this data. So please reach out to Northwestern, get this information, because it's good information, especially as you are doing your grant work right now. All right, next organization that's up to, thank you, Kathleen, for that. I appreciate it. Next organization is Kaaron from PWP. Come and tell us about.
Hi, everyone. So this is my first time attending this meeting. My name is Kaaron Whiteside, and I am the Community Impact Manager for PWP Health in Chicago. We're located on 2930 West Grand. We're in Humboldt Park. We are working with people that are experiencing all different types of mental illness. Our company provides therapy, community support, mental health case management. We deal with crises, of course, transition linkage, aftercare, and we also complete mental health assessments. The good thing about our program is we make sure that the client is comfortable with receiving services from us in many different ways, whether it's coming to our office, telehealth. We will also go to the client's home if needed, meet the client at the library, wherever they feel comfortable having their sessions. The client, in most cases, have a choice of receiving both therapy and assigned a caseworker, and that caseworker is able to work with that client, in some cases, depending on their insurance, up to 13 hours per week. And what that case management and community support, what that looks like, if they are looking for work, if they're looking for housing, if they need help with completing a resume, if they need to do mock interviewing, if they need to sit, if we need to teach them how to dress for an interview. So it's not just mental illness, it's mental illness plus, whatever it takes to help them get on their feet. That is what we do at PWP. We're a behavioral health clinic. And so that's my presentation, my little presentation. I just wanted to hop on and introduce myself, and I will definitely plan on attending more of these meetings.
Thank you so much. We appreciate that, Ms. Whiteside.
Thank you. So I know in the season, right, we're looking for partners to work with. PWP actually is a woman-owned, right, a woman of color-owned counseling center, and it's important with the population that has who might have a issue with problematic use, and as women of color, it would be important to get them with therapists who look like them and have the same issues as them. So it's so important. So Kaaron, please put your name in the chat so people can link with you and so that we can partner and connect and collaborate, especially as I said, as funding season is coming up, it's great to know of other agencies in the area, in our area, that can partner with you, and we can create collaborations that will truly address the needs of our community.
Yep.
How long have you guys been in Humboldt Park?
We've been in Humboldt Park for 3 years. We started off in Virginia. We have a foster care facility in Virginia, and this is our mental health. I did want to say our company is owned by 3 women, 3 minority women, but our caseworkers and our behavioral health team, our therapists, we have a variety. So we have people that say, I only want to work with a male. I only want to work with a female. I only want to work with someone that speaks Spanish. So we have all of that. We're pretty covered in that area, and we're constantly growing our organization. In fact, we're looking for another location. And so with looking at all of this data, it sort of gives me an idea of what location we need to look. It seems like we need to go a little bit west in the area of Humboldt Park, maybe close to, we're thinking like Cicero, Austin, the Austin area. So we're looking, when this is a new task for us. So just getting this data is a plus for us. One of the other things to know is our clients start at the age of 5 years old and up.
Very good. Okay. Do you offer family therapy?
Family therapy, yes, we do.
Okay. Anybody have any other questions for Kaaron?
Okay, I'll add my information in the chat.
Appreciate it. Thank you. Welcome to the neighborhood. Yes.
Welcome.
Yes. All right. Now we're going to move on to our next presenter, and that will be Jake Nichols from US World Meds.
Yes. Hello, everybody. Good afternoon. Absolute pleasure to be here and hear about all the incredible work that you guys are doing in the Chicago area. Again, my name is Jake Nichols. I'm a pharmacist by training. I'm the director of medical affairs at a small pharma company called US World Meds. And I'm also coming up on 14 years of recovery myself. We just wanted to briefly introduce you to our medication. We're still somewhat new in the market. We're getting a lot of efforts around getting awareness out that our product exists. And we are a very unique product when it comes to treating opioid withdrawal symptoms. We're not an opioid like buprenorphine or Suboxone or methadone, and we're very different from naltrexone, which is Vivitrol. Our medication affects the brain chemical, which is responsible for the physical symptoms of opioid withdrawal. And it helps to kind of temper them down, turn the volume down, as I like to say on those. It's a very versatile medication. It's something that we refer to as a bridge. We were out to dinner with a gentleman the other night who coined it the middleman when transitioning people from one area of treatment into longer term treatment with MAT, which I thought was pretty ingenious. We can be used in the early stage anytime anybody's experiencing an opioid withdrawal following abrupt discontinuation of their opioids, whether that's a prescription product or an illicit substance that they've been getting on their own. And, you know, there's no risk of making anybody sick by starting this medication like there is with buprenorphine or naltrexone. Again, it doesn't act on opioid receptors, so it can be used in conjunction with other MAT medications. You know, the biggest niche that we've kind of found for this medication is inducing people onto buprenorphine because the presence of these fentanyl analogs, which we saw in some of the slides, has really complicated the process of inducing somebody onto buprenorphine. And we're seeing this prolonged, protracted withdrawal syndrome in trying to get somebody to MAT. The same thing holds true with trying to get somebody to a Vivitrol shot. You know, you have to wait 7 to 10 days to be opioid free in order to receive that injection so you don't get sick. So we kind of, again, fit in the middle there. We are not a replacement. We're not a competitor to MAT. We certainly don't have any data that says we reduce cravings. We don't have any data that says we reduce overdose death. That's not how the medication works. But it's been very interesting over the couple of years that I've been here to see how this is kind of picked up in the community. And we've ramped up our efforts recently in the Chicago area as we brought a newer representative into the area. And we've connected with folks like Matthew McFarland, who have really been able to introduce us to folks out into the treatment community to get the awareness out there that this product exists. So I did put my contact information in the chat. Please feel free to email me. I'll actually put my cell phone number in too after I'm done here. The name of the medication, yeah, that's important, is Lucemyra. It's lofexidine, Lucemyra. And please contact me with any questions that you have. I don't want to take up too much time because I know we're running a little bit over here, but I'm happy to send you any information and any studies, or we're always happy to come back out as well and visit you guys in person. I'm a Boston guy, if you didn't pick up the accent, so I love visiting Chicago. It's probably the only other city that I could live in. So anything that we can do to help in your efforts, you know, we're more than willing to see if we can do that. We have done randomized controlled trials. I see a question there. We are an FDA approved product. And, you know, again, I can send you that specific information. It was really focused on our ability to reduce the severity of withdrawal symptoms, as well as looking at, you know, some of the potential side effects of the medication, which could include lower blood pressure, or some other, you know, heart-related issues, but we only tend to see those at the much higher doses that are not used too often.
Great, thank you.
Thank you guys for the time.
Oh, no problem. Thank you. Anybody else have any questions for Jake?
Not in the chat. I think he addressed the only one. Thanks for doing that, Jake.
You bet.
Appreciate it. All right. All right, we're gonna move on to op-eds and letters to the editors. We're delighted. We have one person who's sent me a letter to the editor. That's Isabelita from Haas. So hopefully her letter will be appearing soon. But please send letters to the editor. Please send op-eds. Like, tell a personal story in your op-ed, and then back it up with the data and the facts, especially as we are advocating for harm reduction, more harm reduction in our community, as well as for an OPS site, as well as for people who use drugs to have housing, right? Because that was what Isabella Lita's article was about, was people who use drugs and the need for housing for them, right? And so please, you know, as we put more humanity in our work with people who use drugs, we need stories out there and the data out there. So please send your op-eds. We have Susanna McBride from Chicago Sun-Times, who is willing to work with us on this project. And so I'm just looking forward to seeing more articles come our way. Next,
Thank you for that, Fanya. If I can just say, I can't stress this enough, how important it is to take time to write op-eds and letters to the editor, even stress it more so than Fanya just did, simply because my nephew keeps turning off my light. Simply because the most important thing I want you guys to know is that we are on the radar of the press. We have been for quite some time. People are writing about us, and that's even happening outside of Chicago. I was in New York less than a month ago, and folks know who we are. They know our motto. They know what we're doing for OPS. They know all of that. And so to have our name in our local papers with all the legislation and what we're doing alongside Rep. Ford only makes us louder. So those types of things do not go unnoticed. If you need help putting that together, you say, well, I'm not a writer, but I have thoughts. I'm more than happy to hop on Zoom with you guys for 30 minutes to talk about an op-ed and how to put it together. But the Chicago Sun-Times, I repeat, the Chicago Sun-Times is working to publish these for us. And that's a very big deal, folks. So if you want some assistance with writing an op-ed or a letter to the editor, see me. I can get you connected with Suzanne McBride, who can also send pointers. Just wanted to emphasize that. Thanks.
All right. Thank you, V. I appreciate that. All right. Also, too, we have a harm reduction survey out. Sue, you want to speak to that a little bit? Yes.
I most definitely do, good people. Can I share my screen?
Oh.
All right.
Sue Pickett have credentials? Yep, there you go.
All you people on your phones, look up from your phone. Scan that.
All right, go ahead, Sue.
Scan. Can you see? See that QR code? All you people on your phones, all you people on your phones, looking at your phones, texting, hold up your phone and take a picture of the QR code. This is thanks to our lovely Fanya Burford-Berry, who said, we got to have a way to make it easy for everybody to do the survey. This is the harm reduction survey that we talked about last month. I'm going to put a link in the chat as well for the old people like me who like to click on a link. It will take you to our online survey. It asks questions about what you think about harm reduction services, what harm reduction services are needed on the West Side, and opinions about people who use substances. It's really important, please, that you do this survey. Big shout out to Lou and the outreach team. They've been distributing paper copies, so we have lots of input from people who are using drugs out on the West Side about what they need. But we also need to hear from everybody in this room, from your colleagues that work on the West Side. We still hear things that make my heart shudder, like Narcan just encourages people to use drugs. So please, please, please put your phone up, QR code, share it, do the harm reduction survey. Please do the survey. And that is all. Thank you.
Thank you, Sue. I'll make sure that we get this QR code and this document inside of our follow-up so that we can circulate it to our email list as well. Thanks for sharing that. Carolyn Bloom asked that this survey only for people who live or work on the West Side.
Yes, you can still fill it out. We'll still look at your data, but we're primarily interested what people on the West Side who live or work on the West Side think.
Noted. Thanks for that question, Carolyn. All right, I think we're ready to move forward, Fanya. 213.
All right, street outreach team, let's hear your report.
Greetings again to all of you from the task force team. Real quick, I will just give you numbers from last month. Actually, numbers for Narcan distribution forms completed. That's just a form. 453 people used a kit on someone else for an overdose. These are the people we met in the street that have been trained. 139 people reporting a kit was used on them that we engaged with. 74. Number of people trained this month, last month, was 357. Nasal spray kits given out, 1,022. Syringe kits, 19. Fentanyl test strips given out, 569. People taking the tier, 36. People needing ID, we confronted 6 people that we assisted or referred. Clients needing housing that were either engaged or referred, 11. and people needing jobs and income. We encountered and referred 12 individuals. So I'm hoping that information will actually increase for the month coming up. With the weather getting better, maybe we can reach more people. Again, thank you. And that's a report from the street outreach team. Thank you.
Thank you, Lou. I really appreciate all the work you guys are doing and all the points of contact and care. Thank you. All right, next we have Narcan on the CTA. Tom, I see you're here.
Hi, thank you. Our update is really positive. CTA is actively and consistently working with our group now, which is, was such a huge step that we were like delighted to hear, and they're working with us for all the right reasons. We're aligning our goals, and then, because of the strength of this task force, we're able to lean on, some of the organization partners here, like CRA with John Wierning and Cook County Health. And I think I saw Sophia here. So we're using kind of methods that are like the methods of least resistance right now to, and really we're just kind of waiting for policy and lawyers to kind of hammer out things. And we're at the kind of the holding hand part of this, but the end goal that CTA is interested in, we are interested in, is 7 to 9 vending machines on or around CTA platforms. Right now they're all gonna just carry Narcan. But we also think that this step is going to lead to positive results, is going to be a foot in the door for further harm reduction to occur. Right now, the foot in the door is the big thing. We're not gonna, get past our skis, but I can't say enough about when there is like a void and a need for help, how quickly, easily, and how supportive organizations here have been, and just such a display of strength from this field. So and it's remarkable to me, and I just cannot wait to get this implemented. And I know I work with Sheila and Fania. But Sheila, I can't wait to start saving lives for, something that is what brought Sheila to us to start this committee. So it's really positive. I am incredibly hopeful, and I am the biggest skeptic on that committee. So that is a good sign. But if you're interested, next week we have a meeting on Thursday. Even if you just want a full update, usually CTA will be there. You can hear some of the details. It is, we're doing a little bit of a waiting game right now just to find out more information, but we're on the precipice of doing something great.
Well, Tom Nichols, skeptic you may be, but you are also very much a warrior. And I don't think there's anyone on this call that wouldn't agree that our conversation with the CTA would not be advancing without your work. So kudos to you and every single thing that you're doing, and how you have taken the story of Sheila and the loss of her son and turned it into something so real. So thank you.
Not alone, but thank you, Vee. That's very nice.
We really appreciate your work as well. So thank you for your contribution. Thanks for being here.
All right, we have Tim up next with the housing work group report.
Great, thank you. Just for review, the housing work group is addressing these areas of need. Increasing access is the goal for permanent supported housing, emergency shelter, and transitional living or recovery home programs. And last month, we spent the entire time talking about recovery homes, and we had a guest from Advocates for Human Potential. Diana presented on the most updated recovery home map that features Westside residences. I just put it in the chat for everyone to review. But basically what this is, it's been a work in progress for some time. And it's going to be, as I understand it, statewide. But we're focusing, we wanted to ask for the Westside recovery homes to be mapped out and available for all of us to use. So basically, when you click on the link, you'll see that there's a map of the Westside, and all the recovery homes are going to be mapped out on there. And when you hover over it, there's some information about each one: contact information, the address, phone number, website, fees that are involved, whether or not MAR is permitted. Our group gave some feedback. There was a request for some additional information on restrictions in terms of what would restrict someone from being able to access the home, criminal backgrounds, things like that. So that was a great presentation and it was very helpful. And just so you all know, it's a work in progress. So what we have today may look a little different with continued feedback as it continues to evolve. We also had some good discussion about the low barrier to recovery home access and how, continuation from an earlier meeting, what more would be needed. There was good discussion about what the requirements are to admit into a recovery home, and the common understanding is sobriety is required for a certain period of time. It could vary from place to place, and how that is something to really look at now that MAR is in the world and people can start on medication-assisted recovery. And is it a lot of places may still be requiring 3 days or a period of time where a person isn't allowed to move in till they haven't used for so many days. So we reached out to Super to get a little guidance on what the regulation really is, and they're going to come to the meeting on April 8th and help clarify some of that. It's going to be an important one. So the next meeting, link went out just before this meeting to the people who regularly attend. I'm happy to forward it to more of you if you're interested. The meeting will be April 8th from 11 a.m. to 12 p.m. It's a Monday. But that's all we have for today. Thank you.
Tim, I think you can put that
Tim,
in
if you
the
have
chat,
anything
right?
that
The
you want to
link.
include in the chat or later on send to us, we can include that April event in our email blast.
You got it. Thank you.
Sounds good. Thanks.
Thank you, Tim. Appreciate that. We don't have any update from the fentanyl work group, and now it's time to move to member announcements. If you can raise your hand, tell us what's going on. Is there any special events coming up for your organization? What? Anybody's special event, anything that needs to be announced?
Just I'm the guy, right?
You are the guy.
To keep the meeting going. No, I think it's May. Is it May
Almost had you guys
7th?
out of here 7 minutes early, and here goes Lee Rush. Go ahead,
Is it
Lee.
May 7th, the Fentanyl Awareness
Fentanyl
Day?
Awareness Day. I was gonna type that in the chat. And if anyone's doing anything for May 7th, Fentanyl Awareness Day, or want to work with us to do anything, let us know. But yeah, that's true.
My Siamese twin there, V.
Mhm.
So, and the other thing regarding the fentanyl work group, I think we do know we have some organizations that received the CDPH drug checking grant. And I think that would be great to reconvene the fentanyl work group to kind of talk about how that information can be shared and what we might do with it moving forward. And congratulations to those. I don't think anybody announced who it is, but those who are on this know who got it. So congratulations to those, and we will put you in. We'll put you to work very shortly in that fentanyl work group.
Thank you, because we have Rush and having the toxicology piece happening, so that's exciting. Yes.
And you can tell from Luther's report that people do want to know what's in their drugs. And that's probably part of what the decline in deaths is all about. So
Mm-hmm.
let's keep working on that.
All right. Oh, I see John.
Hey everyone, sorry to add just to the last minute. I know we're in the home stretch here, but along that note, CRA has had its FTIR training program. Taylor Wood is on this call, who is our lead technician and runs the trainings in order to get, I guess, more or less certified to do FTIR trainings. So if you are one of those agencies that got money from the CDPH and you to do FTIR drug checking programming, Taylor we do have the capacity because of Taylor to train folks on that. So we're actually, I think, the only organization in the state that can do those trainings right now. So Taylor, I don't know if you want to say anything more about that, but please reach out if you need those services.
I appreciate that, John. Yeah, just to reiterate, CRA is the longest running direct service FTIR program in the United States. We have a lot of experience with training technicians, both on a national level as well as a local level. We're currently involved with a program with Cook County to provide training to 3 other teams as well. So we already have that ball rolling, so to speak. So with any questions or comments, please feel free to reach out to us. And I'll put my email in the chat.
Thank you, Taylor. I see no one else has their hand up. All right, Lee, do you have a comment? Are you the one that's going to say, is there any homework, teacher, that we have to do?
Zoom call ended.
Hey, how about giving Fania a hand? She's been in the chair for what,
Fine,
4
you're
months
doing
now,
it.
and keeping the ball rolling and actually pushing the ball a lot faster than it was rolling before.
I actually did.
Fantastic.
You guys, the presentations were,
and then I will get back to you, okay?
The presentations were excellent today. We meet again April the 17th at 1 o'clock. So I will see you all probably before then. All right. You guys have a blessed afternoon. Okay. Bye-bye.
Bye, everyone. Thanks for
Thank
joining.
you.
Everyone. I'm going to save the group chat, Fania and Lee, so that we can have it on documents. And then
Excuse
Lee,
me,
you can
I was
start
going to ask, how do I get a copy of the group chat?
Oh, you're on our email list, which is probably how you learned about this meeting. Then we follow up, and all of this is included in the follow-up.
Okay, got it. Thank you.
Welcome. Thanks again. We hope to see you again April 17th,
All right,
same
I
time.
will be here.